A woman's health should depend on who she is, or where she works, or how much money she makes. Every woman should be in control of the decisions that affect her own health. Period. This basic principle is already the law in 28 states across the country.
The Affordable Care Act is the federal health care bill that President Obama signed into law in 2010. Under this law, private health insurance plans are beginning to offer birth control without copays or deductibles.
Contraception is defined as the deliberate use of artificial methods or other techniques to prevent pregnancy as a consequence of sexual intercourse.
Contraception is mostly used for family planning. Unintended pregnancies account for almost half of all pregnancies in the United States. Insurance coverage of contraception has been shown to increase utilization.
How does the Affordable Care Act work, and what does it do? Although its full name is the Patient Protection and Affordable Care Act, you've probably heard it just called the Affordable Care Act or Obamacare or the ACA. It's called Obamacare because President Barack Obama signed it into law on March 23, 2010. But what does it actually do? Let's look at the basics. Healthcare in the United States has some serious long-term issues. First, there are millions of uninsured people. Second, people who do have insurance tend to pay more for it than they would in other comparable countries. The ACA aims to fix these issues by making affordable healthcare available to more Americans.
Though there were many important changes made through the Affordable Care Act, some things did stay the same. For example, if you already have a health insurance plan under your current employer, you can keep that plan. The Affordable Care Act covers one type of birth control per person from each of the 18 FDA-approved categories at a no out-of-pocket cost, although some plans do have exceptions. FDA-approved methods include barrier methods like diaphragms and sponges, hormonal methods like birth control pills and rings, implanted devices like IUDs, emergency contraception like Plan B and Ella, and sterilization procedures. Plans are not required to recover drugs to induce abortions or services related to a man's reproductive capacity. Not all plans have to cover birth control. For example, religious employer health plans, grandfathered health plans, and short-term health insurance do not have to cover birth control at a no out-of-pocket cost.
What benefits does contraception have for women and their families? More than you might realize. Contraception helps young women postpone getting pregnant until they finish school or job training. It helps women and couples plan their childbearing, avoiding a pregnancy that follows too soon after a previous one, or one that occurs after a family is complete. Women whose pregnancies are planned are more likely to receive timely prenatal care. They are less likely to smoke or drink during pregnancy and more likely to breastfeed once their baby is born. That's why contraception is essential preventive health care.
Contraception has not always been comprehensive for women in the United States. The Comstock Act passed in the United States prohibiting advertisements, information, and distribution of birth control and allowing the Postal Service to confiscate birth control sold through the mail. The federal ban on birth control ended the Comstock era. The first oral contraceptive, Envoy, was approved by the U.S. Food and Drug Administration as a contraception. The Supreme Court gave married couples the right to use birth control, ruling that it was protected in the Constitution as a right to privacy. However, millions of unmarried women in 26 states were still denied birth control. FDA approved IUDs, bringing early versions like the Lippes, Loop, and Copper 7 to market. The Supreme Court legalized birth control for all citizens of this country, irrespective of marital status.
The introduction of widespread birth control for women meant that sex did not have to lead to pregnancy. Contraception gives couples the opportunity to plan their families. Women can choose if and when they want to have children. In general, the number of children per family has decreased since the widespread use of contraceptives.
In many African traditional culture settings, pregnancy before marriage is often viewed as an abomination. As such, Many unmarried females who get unintended pregnancies seek abortions services for fear of social judgment. In Uganda, the risk is unintended pregnancies and unsafe abortions remain high due to rather low contraceptive use. A survey was conducted in Makerere University main campus on Kampala, Uganda during April 2014, where research assistants interviewed female undergraduate students on their attitudes and use of contraceptives. A total of 1,008 females responded to the survey. Over 46.6% reported current contraceptive use, with male condoms being the commonest method. Knowledge of any contraceptives was almost universal.